We get into our next presentation, which actually is a panel discussion. It will be moderated by Luis Arango, the global consultant with Cedars-Sinai Medical Center. The panel consists of Nicole Dube-Rosson, Global Operations Director at Cedars-Sinai Medical Center, Dr. Vinton Douglas, the Deputy CEO at the Cayman Islands Health Services Authority, Kahlill, the General Manager of CINICO. We were supposed to have Dr. Binoy from Health City, but as is the case that you can appreciate with medical professionals, he's been called into emergency surgery. But despite that, deputizing for him, we have Health City's Director of Sales and Marketing, Rebekah Brooks, with us. The topic on tap is, what are we looking for in public-private, local, and global healthcare collaborations? At this stage, I will invite Luis to the podium, take over, and run the show.
Good morning. It's always an honor and a pleasure to be in the Cayman Islands. It's not my first time at this conference, but it is the first time I'm a moderator of such a distinguished panel. So what we're trying to do with this panel is get different perspectives on the topic of healthcare from private players, public players, domestic providers, and global providers, and see how they interact and how the interaction of these different perspectives results in benefit of the patients. For us at Cedars, the final objective of anything we do is to improve the quality of care and the patient experience locally and internationally. So we have some very distinguished participants that will help us look at these issues from their own perspective, and at the end, we can draw some conclusions that will be helpful for everyone here. We are here to learn, not to teach. We have to learn about the reality of healthcare in the Cayman Islands, which has made a lot of progress in the last few years. So I'm going to make some questions, and then at the end we'll have a discussion of the responses we get. My first questions to all the panelists, and they'll have the opportunity to answer, is, what are you looking for when you engage with the patient in healthcare? So the first perspective will come from Nicole. Nicole-Rosson.
Thank you. Thank you, Luis. Just for the benefit of the room, since its inception in 1902, Cedars-Sinai in Los Angeles, California, has evolved to become one of the largest nonprofit hospitals in the Western United States. Today, Cedars-Sinai is an $8 billion integrated health system. Oh, the microphone? Okay, sorry. Is that better? Or should I just move it closer? Thank you. Thank you. There we go. Okay, so today, Cedars-Sinai is an $8 billion integrated health system with over 1,000 beds and treating over 1 million patients a year. As a leading academic health system in the United States, our mission is to elevate the health status, not only of the communities we serve, but people around the world. We are committed to the well-being of the global population, regardless of race, religion, political background, or socioeconomic status. And we look to partner with organizations who have shared values. And it's not only who we treat, but how we treat them. And to echo the sentiment of Mr. Scott and Ms. Yearwood yesterday, we put the patient at the center of everything we do. If you're not there looking out for the patients and their family, what are you actually really doing? So whether patients are seeking care in Los Angeles or closer to home, who we treat and how we treat them is at our forefront. Additionally, we look for healthcare organizations that place high quality care and patient safety at the very top of the pyramid. as well as adhering to international standards or aspiring to international standards such as Joint Commission International. Thank you.
Okay. Now we have Rebekah from Health City. Thank you very much for filling in for Dr. Binoy. And please let us know your insight.
Hi, thank you very much for having me. So I think when we look for partners within healthcare, we looked for the similar sort of same quality of healthcare that we try to provide. We like to look for affordability, patient-centric, as you were saying, is very key to us. So we like to work with the public partnerships that we have with HSA and other private entities on island, and also the not-for-profits as well. So we work a lot with the Cancer Society, the Breast Cancer Foundation, all to provide good quality healthcare for our patients here. And of course, we also like to work with our overseas providers as well. So we actually have a collaboration with Dana-Farber Cancer Institute. They're here today. So that not only does that sort of open up the whole globe to everybody else, but it also helps with sort of research-based trials and observerships for the physicians, that kind of stuff. So the whole idea is to provide patient-centric care that's affordable and high quality, and I think in the Cayman Islands we're very, very fortunate to have very high-quality healthcare from both the public and the private sectors, so we're very, very lucky and very fortunate. Yeah.
Thank you. So now we have Dr. Douglas from Health Services Administration, and he's going to explain us the role of global collaborations in shaping public health.
Thank you very much, Mr. Chair. Good morning, everyone. We can all agree that public health care have become indispensable in addressing multiple gaps in terms of knowledge, resources, and of course, policies. Now, based on my experience, I can say that knowledge exchange is paramount in this instance. So therefore, international collaboration will provide us the adequate expertise for best practices and evidence-based approaches. What that means for the HSA is that we can leverage cutting-edge technology and so on in this emerging global health trends. Another area that we think it will be important is technology and innovation transfer. So in today's digital world, when it comes to telemedicine and AI, this is paramount, so we can leverage with our global partners. Health security and preparedness is another area that we can leverage on. So we all know that we have been through the pandemic, and leveraging with these, with our global partners, that actually assisted quite well. We are an island, so capacity building is important. So, and that will strengthen our local system by providing critical training, providing resources, and that will keep us up to date. Thank you.
Thank you, Dr. Douglas. And finally, we have Mr. Kahlill Strachan from CINICO, the Cayman Islands insurance company. He's going to talk to us about his expectations from global health providers regarding cost, quality of care, and access.
Thank you. I'll first start and say I'm very nervous right now because I tend to stand up and walk up and down when I talk, but I'm seated today, so let's see how this goes, okay? At CINICO, we have some core values. Those are, we want to interact with our patients and people with honesty, integrity. We want to be compassionate at all times. We want to provide be excellent in everything that we do. We want to be reliable and dependable, and we want to be innovative. So as that is our values, it's important for us to partner with institutions, both locally and globally, that share those values. And that's a starting point for us. As it relates to access, I think everyone in the room, we would like to be able to partner with entities that are allowing our members and patients to get timely care, because we deem that as being critical. And the quality of care, so we want to partner with entities that are centers of excellence, that their patient outcomes are measurable, and their outcomes meet the expectations, yeah? In addition, cost is where I sit, a big driver. Cost should not be the thing that determines care, but I will say that cost is something that we are very mindful of, especially in 2024 and going forward. So value for money is really something that we actually would like to see with our partners. And that's something I will throw out, and some of you in the room, we may have had these conversations before. Discounts, I think, are where and where possible, are something that we would often look for, because at the end of the day, it's patient care that we're trying to do, and we want all patients to have access to good, affordable care. Thank you.
Thank you, Dr. Douglas. Yeah.
Thank
Dr.
you for the new
Kahlill,
title. I appreciate it.
Kahlill. I got confused. I'm sorry. Happens all the time. Well, the next question is for CINICO again. And I have a special interest because even though I've been in for almost 20 years in international health, I worked in insurance for almost 30 years. So I have a special interest in this answer. It's that there are several elements important for the role of the insurance. And one of them, obviously, is having fair rates, affordable pricing, but also it's very important to guarantee patient experience and patient access. So how do you see in CINICO the role of insurance in facilitating global healthcare interactions? Because it's very important. You are like the midpoint between the provider and the patient.
So no pressure? Okay. I think it's important, oftentimes we speak of a formula in our office, yeah? Where any healthcare provider falls is really generally at the other side of this equation. Healthcare cost is not something that we have any real control over, yeah? That cost, if healthcare costs go up, claims costs generally also go up. If claim cost goes up, then the next thing to go up is premium costs. If premium costs continue to go up at a level that is unsustainable, I see some colleagues, and Felicia, Rachel, and Dr. Gent, there were some key things you guys put up. When you made reference to the costing of how much money folks are making within this particular society, I got concerned from the perspective of, if we're saying that, and I did the numbers, I think the numbers showed me that at least 66% of the people are under $70,000, right? And if that is the average household income, and if healthcare costs continue to grow, how then are we going to be able to afford this? So, and I just throw in here, just to give an idea of the cost. Again, some of the things that we've been dealing with. Pharmaceuticals, for instance. Back in the day, an expensive pharmaceutical was $5,000. Yeah, I've seen pharmaceuticals costing in excess of millions of dollars for one dose. If your policy has a limit on it, let's assume that limit, lifetime maximum limit is $3 million. Your drug, one-time use, is $3 million. Guess what's going to happen? And you need 5 doses, as an example. What happens? So when you ask what our role is, I think I just waved the white flag to say, listen, we need to do something. I think we have the right people in the room. CINICO needs to and will be a part of having those conversations. We have data. We want to be able to share and use that data in a manner that gets us to make changes and healthy changes. I was pleased to see discussions about wellness, because that's exactly where we need to go. At the tail end, Dr. Gent made reference to companies doing things differently Yeah, I hadn't planned to say this, and I'll quickly say this. I can tell you all, in my opinion, when all of our health journeys went awry, yeah? The minute we left high school, we stopped doing PE. It's just an idea. It just came to me with Dr. Jen, Felicia, and Rachel's conversations. Maybe we need to implement that back into our workforce. So as an organization, you ask, what is our role? Protect the patient. Be a part of any changes to laws and regulations that will come. We want to be a part of those discussions. Wellness discussions are important. We need to stop just using it as a tag word and put meaningful things in place to facilitate that. If we get healthy, if we get healthy, our costs are going to go in the opposite direction. And hold accountable providers in any network. Bad actors, we don't want you. Good actors, we need you. Thank you.
Thank you. Our next question is for Health City, for Rebekah. And Health City, as a top health provider in the Cayman Islands, it's probably engaged in many conversations and projects with international providers, like you have with the Dana-Faber Association. We've had some conversations also with you. But my vision, and before I do ask the question, is not to be competitors, is to collaborate, to work together, and our goal is to improve the quality of services locally so patients in Cayman don't have to travel to other countries to get the best service available. Having said that, what are the points that are important for the health services? Sorry, I read the wrong question. What are the specific challenges and opportunities you face as a private healthcare provider when interacting with a global healthcare entity?
Sorry, you said the challenges that we face?
Excuse me?
You said the challenges that we face.
Challenges,
yeah.
yes.
So I wouldn't say there's a huge amount of challenges, but what I would say is that specifically when you're talking about that sort of ecosystem of healthcare, when you are liaising with global health systems as well, it's important to keep the patient at the center of everything. So it's navigating the whole healthcare system at the same time. So if patients are going overseas because the services aren't available on island, then we need to make sure that we have that connection with the overseas provider so that they can come back and the care can continue as they come back as well. So I think that's probably the main one. The second one probably would be affordability. So as we said, we do have a partnership with Dana-Farber. That's perhaps not also affordable for everybody, but what we can use is their expertise, say virtually or from tumour boards that we have, and our doctors going over for observerships, all that kind of thing that can actually be brought back into Cayman so we can provide the care here rather than them having to travel overseas. And then I think probably the last one, but I'd like to think that we managed to keep up with that, is that obviously all the other international hospitals, well not all of them, but Dana-Farber in particular, and a lot of the other big top names over there have very high standards of care. And so we ultimately need to keep up with the same standard of care that they have to keep ourselves aligned with them as well. So we strive to do that each and every day with, you know, JCI accreditation and all the other factors that we play each and every day. So yeah, that would be it. Okay. Thanks.
Thank you. The next question is to the Health Services Administration. As a public entity that it's a provider of health services. And it's similar to the last question, but from the public perspective, which also has a special interest for Cedars-Sinai, because we are trying to engage what we call health diplomacy, and that it's look after relationships with public authorities in every country to help them improve public policy, public services, in aspects like preventive medicine, nursing, which is in crisis all over the world. So I think this is a very pertinent question with the Health Services Administration. What are the points that are important for the health services as a public provider to engage in a relationship with a global provider? Additionally, what kinds of specialties, treatments, and procedures are you looking for from an international provider?
Thank you very much. Thank you very much for that, for those questions. I'll start off with the specialist. Firstly, access to specialized care in our region, it can be a challenge. So by engaging with you as a global provider, the HSA on a whole can expand access to these specialized treatments, especially in the areas of oncology, cardiology, pediatric care. Secondly, enhancing treatment options. This collaboration, of course, will allow us to integrate advanced treatments and procedures that may not be offered locally. And this could include things like organ transplants, cutting-edge cancer therapies, or new approaches in mental health care. As perhaps you are aware that this is exploding within the Cayman Islands and globally, of course. And this, of course, would lead to broadening the range of treatments available to our population. But I want to delve a bit deeper in the treatment of cancer therapies. What we don't have here that could benefit us is, or should I say, one, access to clinical trials. That would be paramount. We do some amount of radiation here with our private partners, but not the use of targeted radiation treatment for cancer, and such as your MR-Linac, and that's actually focusing on the cancer cells itself, for those who are not aware of that, what that is. I want to say a bit also from the pediatric side of treatment, that surgical procedures such as your congenital heart diseases and so on, this is not something that we readily do within the Cayman Islands, even though we do it to a limited extent, but we would benefit from that also. I'm going to go back a bit now on our mental health treatment. Of course, we offer traditional mental health treatment here, but cutting-edge or emerging technologies, such as your transcranial magnetic stimulation, we do not offer that within the Cayman Islands. And for those who are not aware of what that is, actually you just pass a magnetic wave in the frontal lobe here, and that stimulates your mood and so on. So for those refractory depressions that are not, Dr. Magill, am I correct? That are not working with your traditional medication, then you can offer those treatment modality. My understanding that has been recently approved by FDA. So it's a treatment modality that is available globally. And finally, research and data sharing is paramount. The more data we get, even though we want to see what we have locally, but we can also leverage on what we have overseas in order to treat patients and get better outcome. Thank you.
Thank you. And finally, for Nicole, how does a global healthcare provider tailor its services and collaborations to fit local healthcare needs and regulations?
Thanks, Luis. So right now, Cedars-Sinai has 11 affiliations or collaborations around the world. And we know that what works at our main medical campus doesn't necessarily work elsewhere. And this is true even if you go 5 miles down the highway from our main hospital in West Hollywood. So in some countries, before we even enter into a collaboration, we engage local physicians, nurses, healthcare administrators to help us better understand the local healthcare environment, whether it's understanding staffing challenges, regulatory requirements, specialty needs, or payer systems. It helps us to be better informed from day one. We also strive to be creative and nimble in how we employ different models based on the partner's needs to amplify their strengths as well as our own, and bolster areas that may need enhancement. A couple examples, when we were approached by Taikang Insurance, which is actually one of the largest private healthcare insurance companies in China, to help them develop a hospital in the free zone of Shenzhen, we realized very quickly that government support was essential for the success of this hospital. So we actually entered into a four-way agreement, which was not easy by any stretch of the imagination, but it included the local government entity, as well as a leading research and medical school in the district. Also, when we enter affiliations and joint ventures, we will oftentimes create a clinical integration office there on the ground. And we place staff from Cedars-Sinai in Los Angeles to wherever it is, in Ecuador, in Qatar. And it does a couple of things. On the one hand, it creates or provides the essence of Cedars-Sinai, but also in an appropriate manner to that local entity. But it also really helps our team best support the local team there on the ground. So working shoulder to shoulder to really understand the challenges that they're facing. An example of this is we have an affiliation in Qatar. It's a private hospital, brand new, and the private sector is still very, very new in Qatar, very, very challenging, and the government provides, I would say, about 90% of the healthcare. So our team works closely with the hospital management team as well as the Ministry of Health to build trust and to also work through various challenges, whether it's how do you license and credential privilege international physicians, because the vast majority of physicians happen to be from elsewhere. Working on offering clinical services that are only available right now in government hospitals, developing clinical KPIs that are reported on and that there's transparency on the care that's being provided within the hospital, as well as working with insurance companies who really have never had to work with anyone other than the government. So we find that employing different strategies really creates win-wins, both for us as well as for the local team. And our goal is really to create an environment that respects the local teams on the ground, as well as leveraging our global expertise to really improve the health of the population.
Perfect. We are open now for questions from the audience. I don't know if we have any questions, any remarks. Let's see. No, apparently everything was very straightforward. Oh, yes.
Thanks very much. I found that the collaboration in Cayman between the public sector and the private sector hasn't been that robust in times gone by. And I think, the element of trying to make sure that information goes between the hospital and the private GP is something that, as GPs, we struggle with. So we don't have access to the computer systems for security reasons, but the patients come back and they don't always have the information on the procedures that they've had. And we're always told it'll happen, and then you spend days trying to get, the operative report or the post-op, the blood tests and things. So I think, trying to have a system that is more coordinated between the private sector and the hospitals, whether they're private or public, would really help a lot. It would help the patient at the end of the day.
I have a comment and then a question. Thank you, all the presenters. Mr. Arango, you started out by speaking about the end game, which is to improve quality care and patient experience, which is great. So all of what we're talking about, that's where we're heading. I found it quite interesting, the STEP survey. We had a breakdown of the different races there. I'm curious though to find out, I don't know if the survey covered it, in terms of nationality, right? Because it would be interesting to see how that, how those different things affect the different breakdown of nationalities in this country. Why that's important is because it also indicated not only the income of the individuals that were surveyed, but also the challenges that each individual face. We saw the different types of insurance, and I found it quite interesting that people are accessing local provided insurance more so than the SHIC plan. I know CINICO is the main driver there. So my question is for Mr. Strachan. Strachan. All right. Here's my question.
Strawn.
Strawn.
Yeah.
Thank you kindly.
No worries.
It's because you made mention of increasing wellness to bring the cost down, right? Would you suggest that the benefit for the year that should increase? Because it seems as if the persons who are most affected with the SHIC plan, right, are those who have the most risk, as we could see, right? Then if maybe the wellness, the benefits, because I'm thinking even mental wellness, which I know the STEP plan did not include, you know, it would probably, based on what you suggested and what you said, would you recommend that to the minister?
So I'll answer that like this. And just so we're clear, the SHIC plan is the standard health insurance, oh my gosh, contract, yeah. I told you all I need to stand up. That is something that has been mandated by law that every Class A insurance company must offer to the persons within the Cayman Islands. So I say that to say that we have no control over that plan. But if you're asking me if I believe there should be, it should be looked at, I don't remember the years, but it has been a while since someone has looked at the plan, and I believe it is something that should be done, and I also believe it is something that is being done. As it relates to CINICO as an entity, it is an area that we're looking at to provide additional plans for persons within the Cayman Islands because of some of those concerns that you raised. Thank you. Hopefully I answered that.
Good morning, panelists. In the ecosystem of the 4 companies that we see up there, how are you guys, do you have a plan to work together? And if you have a plan, could you share that with us?
Okay. Just briefly, just to say, you kind of stepping on my toes in my closing statement, but I'm not aware of a specific plan. What I can tell you, though, is there's a lot of communications between all of these entities that are up here. And that is of paramount importance. Do we need to do something a bit more formal and specific? I would love to have those types of conversations in light of the STEP information that's been shared, because I can tell you, you know, you can observe something, and if you do nothing about what you observe, then nothing gets done. And I don't think anyone up here, and I'm hoping that no one out there, wants to not have change or effective change be done. And so that's my answer in that space. I hope that helps. Yeah. He wasn't convinced.
Okay, so I think we have no further questions. Oh, yes.
Yes, hi. Good afternoon, good morning to your panelists. I live in the BRAC, and I'm a bit concerned with some of the fact that there's not a lot of care coverage for moms when it comes to pregnancies. There's very little of that. Majority of the pregnant ladies in our community at the BRAC has to fly to Grand Cayman to get I think it's prenatal care. And a lot of those parents are on CINICO because majority of Black women are government employees, which are covered under CINICO. So I'm just wondering when that's going to be improved as well. And then I also have something else to say. I know the standard health insurance contract was basically introduced to cover work permit holders. And it came with very little in the original beginning. And of course, we fought for more coverage. And it increased to $1 million for major medical and $400 a year for outpatient. When are you going to increase that for outpatient as the cost of everything has gone up? And since a lot of work permit holders are basically the ones that are under that coverage, we're thinking that maybe there's a time for that to be improved, modernized, and brought up to date as far as cost goes with medical care in the Cayman Islands. So hopefully we can see some changes quite quickly. And that's directed at the General Manager of CINICO.
Thank you very much. I'll take the first part, then I'll pass on the baton. Well, what we can say about the BRAC, we have recently hired an OBGY specialist, so we are about to improve things. And a pediatrician will be on the way very soon. So as you know, maternal health, yeah, thank you. Maternal health can be quite complex. We don't want to take those chances in the BRAC. So we want to fly them over to Maine just in the event. But things will be changing soon because we'll have the specialists within your hospital. Thank you.
Actually, I smile. It for me, is an easy question from the perspective that that CHIC plan, is not something that we have any control over. So it is a plan. Any changes to that plan does not exist with CINICO. I know that there are other health insurers out here. All of them offer the same CHIC plan. CG Brit K, Cayman First. We all have to offer the plan. So if you're asking if there should be change, as I said already, I do think it's something that should be looked at, but it's something that we don't have any control over. Except from an advisory perspective, as I said earlier, I believe we should be communicating more, getting information from the relevant parties, so that we can actually ensure that when and if we do decide to make changes, the changes have tangible benefits to the persons who use these plans.
Well, I'm one of the long-term health provider in Cayman Islands, and what I have seen is that the burden of the healthcare insurance on the citizens of the Cayman Island, or you can call residents of the Cayman Island, is making them to transfer most of their health insurances to the government insurance, which is CINICO. And this is a continuous transition happening. So what are the procedures or the policies you are creating now? Because this burden is going to continue to increase from private to the government system. And how you incorporating and making policies for the future. This is a very important point because this burden is going to continuously increase on the government. There is a talk about that I know that Health City is trying to create their own insurance system. So to provide a general public their system to really just use the Health City system for the health. So these are the two questions I had in my mind.
Can I leave that question with, and just say that your observations are also some of our observations? And I appreciate, I think we all just need to be aware of the circular, not argument, but thing that is occurring, because you made reference to persons and it's a bit more nuanced than how you described it, but yes, we've observed the same thing. And it is something that hopefully, if we can get to my conclusion is that we need to communicate more. And not just have conversations, but have conversations with solutions. Because there are solutions to these problems, but if we continue to just observe and do nothing about them, I think where you were taking this, we're going to end up becoming, it's unsustainable. We're going down a path that is unsustainable, and if we have patience first, and if that is the goal, God, I mean, you know, I do not want to go down. If you meet me outside, we can talk, because I have, I'm passionate about two things, yeah? And it's come up, and I'm just going to share it, and this is what I see off of data and stuff, is young people and their mental health, and the older people in our society. We all grew up in a place in the Caribbean and stuff like that. We take care of persons when they get old. I appreciate the applause, but dare I say, we need to do a better job in that space, okay?
Thank you all. So we are running out of time, so I'm going to invite our panelists to give, each one of them to give us their final thoughts. Let's start with Nicole.
Thanks, Luis. Yesterday, the deputy governor, during his opening remarks, shared a quote from American Ralph Waldo Emerson: "The first wealth is health." And I'll admit that's the first time I heard that quote, and I guess I wasn't paying attention in American English class, but I thought it was such a fitting quote. And I think it perfectly captures personally and professionally what I strive and what Cedars-Sinai strives towards every day. We believe it's our duty to work together within the healthcare ecosystem to support our global population in achieving and maintaining good health throughout the continuum.
So now, Dr. Douglas.
Thank you very much. I would like to emphasize the importance of collaboration. Global collaborations are vital to the healthcare ecosystem in the Cayman Islands. That's going to enrich our knowledge, specialized care, technology, capacity building, and last but not least, health security. Thank you.
Kahlill, please.
Okay, because we've been talking about wellness, my CEO is Michael Gale. He tells stories. I'm going to tell a quick story. Some point in my existence, I was supposed to be to track practice. I arrived at track practice late. My coach looked at me and asked, "Why did you come to track practice late?" I looked at him and said, "I was at softball practice." He then said to me, "You need to make a decision. Are you going to be the jack of all trades and master of none?" So I leave you with this. I think as it relates to collaboration and communication, we, as it relates to our healthcare within the Cayman Islands and globally, need to make decisions as it relates to where are we going to excel at, share that knowledge, and share as a community of healthcare providers so that we're not forced to be everything to everybody and fail at being great at one thing. And that is the thing I would like to leave us all with.
Thank you. Rebekah.
My final thought is to really focus more on prevention. I know from my nursing background, we've been saying it for a long, long time that prevention is better than cure. And I think going to your point of sort of decreasing healthcare costs, we need to look for more of an integrated healthcare approach where we actually focus a lot more on preventative healthcare. So I do agree with the lady over there that was saying to increase the preventative standpoint. It's much better to catch things earlier rather than later. And then my second point would be collaboration, collaboration from the public, from the private sectors, to all work together, and also obviously from the global perspective, which we've got a lot of great partners here today, and also just at our fingertips when we need them. So better collaboration, less competition, I would say. Just let's work together to generate a better healthcare for Cayman, because that's what we're all here for.
Thank you. So thank you, everyone. I think we're done for today.